Hi, this is Henry Sanders back with another episode of Real Talk. We want to thank our sponsors at Park Bank. Thank you for everything that you're doing, supporting us. Thank you for Facebook Journalism Project for supporting us. If you want more of this content, please go to our YouTube page. Go check out our podcast. We have lots of wonderful content on there, especially if you're interested in what's going on in our community, especially communities of color. Awesome content that you're going to find. So today I have someone who's from from Philadelphia. She is here and now in Madison. She has a very, very, very important position. And most of y'all probably don't know this sister. That's why we're bringing her on here so y'all can get to know her. She works over at the Public Health Department for the city in Dane County. So she's extremely important this time, especially for COVID-19. She has a long title, y'all. I'm not even going to try to director or something, planning something. But it's important. It is important. It's an important title, but it's long. It's long. Sister, how are you doing, Aurielle Smith? How are you doing?
I am good. Thank you so much for having me on today.
Yes. Okay. I was messing. So why don't you tell people your title so don't think I'm trying to be too bougie or something. Just tell me what your title is.
So my title, I am the Director of Policy Planning and Evaluation with Public Health Madison, Dane County. So lots of roles, lots of hats, and a position that's changed a little bit as we're doing some COVID-19 response efforts. That's a long title, right? I'm telling you, that was a long title. So how long have you been in the position? Yeah, so I actually started with Public Health Madison, Dane County on March 30th. So 2-ish months almost, maybe a little bit more. So
you're new to the game, new to the city. How long have you been in the city?
So I've been in the city for 4 years. And so I've worked in public health for, about 7-ish years now. So not totally new to the game, but new to the department. And I'm really happy and excited to be here and serve the residents of the city and county of Madison and Dane County.
So when did you move from Philly to here?
I moved here in 2017.
From Philadelphia?
From Philadelphia.
Okay. All right, let's start here. Let's start here. So tell me the difference from black folks, the black culture in Philly versus the black culture here in Dane County.
Oh, yeah, that's a great question. So I think, there's actually a lot more similarities. I think the black culture here is still encompassing of that Midwest, like super laid back culture. I am an East Coaster, so I am very, a little more direct than my Midwest friends here. But I think the level of community and culture is actually really similar. I see both groups being very tight knit. We look out for one another. We do what we can for each other, and we do our best to kind of uplift our communities. So for me, it wasn't too much of a transition, and I think I've definitely gotten a warm welcome to the community here thus far, which I appreciate.
What college did you go to?
So I went to Gannon University. That's in Erie, Pennsylvania. So for those who are not as hip on their Pennsylvania geography, Philadelphia is in the right bottom corner, and Erie, Pennsylvania is in the top left, about 2 hours north of Pittsburgh.
Yeah, I know where Erie is for sure. You are now here's the question, Miss Smith. Here's the question.
Okay.
Packers.
Ooh.
Eagles.
I am a diehard Eagles fan. I am a diehard Eagles fan. I will say my significant other, though, he is a diehard Packers fan. So we are house divided.
I had to balance it out somehow.
We did, but it was great. My dad actually got to go to Lambeau Field for the first time last September, and thoroughly enjoyed it. The Eagles did beat the Packers, so we were happy. But but I still do enjoy a good Packers game. I do still go.
Okay. And last Philly thing is it hoagies? What's the sandwich in Philly that's really known for? Is it the hoagies?
It's Philly cheesesteaks and hoagies. I think we also claim hoagies too. Okay. But yeah, it's a Philly cheesesteak.
Never had either one. I've had a Madison Philly cheesesteak, never a Philly cheesesteak. I've only been to Philly once though. My aunt actually lives in Philly. I've only been out there once. Yeah. So okay, enough about that. All that stuff about why the Packers are better than the Eagles. I'm glad you admitted that the Packers are. We'll make sure we edit that part. Make sure that. Well, who's your favorite team? The Packers or the Eagles? You're like, the Packers. Okay, so seriously now, you're in an important job, and I know you're helping coordinate some of the testing.
Yes.
For all the COVID-19 stuff, and you're helping out. Are you still at Alliant Energy?
I am. That's actually where I am right now. So I've got the lovely Alliant background.
Okay, we have a lot of love for Alliant. Alliant Energy shows us a lot of love. One of our big supporters. So tell me about the testing, how long you guys been at Alliant, and just the process, what's going on out there.
Sure. So we've been at Alliant for quite some time now. It's definitely been, I think, about 6, maybe 8 weeks. And so the process here is mostly drive-up testing, although we do offer walk-up, bike-up testing lane as well. And it's pretty simple, pretty straightforward. We give you an information packet at the front gate. You drive your car around to our testing lanes. We collect some information from you, mostly name, address, phone number, so that we can contact you with your results. You'll drive right up to our swabbing station, and they'll stick what I like to call the long Q-tip. It's about this long, but it goes right into your nostril. It stops it right about there. They do a couple swabs. It does not hurt. It's a little uncomfortable. You might tear. You're not crying, but you might tear. You might do some sneezes. And I think the entire process from start to finish takes about 4 minutes, and then you're on your way. We're averaging around 5 days to get people their test results back, although some come back within 24 hours, some come back in 2 days. But we like to say 5 to give us a little bit of cushion. And then if you are negative, we let you know that you're negative. And if you're positive, then we do some kind of follow-up and case consultation to make sure that you're not experiencing any symptoms. And if you are, we direct you on how to get care. And we just make sure that we're taking care of you. It's our job as the health department.
So I know there's a lot of false negatives, right? So someone can get negative and they really be positive. And so how many times can someone get tested?
Yeah, so you can get tested as many times as you want. We do have some individuals who are getting tested on a weekly basis. I don't think we have anybody who's daily, but maybe. But that's why we're open and we're free, and we have these wide set hours. We know that a lot of, especially our people, are in work environments as some essential workers, and we want to make sure that they have access to testing as they go into those environments and provide those essential services. So no limits on how many times you can get tested. You can come every day if you want. And yeah, we really just want to make sure that if you feel that you've been exposed, that you have the availability to get tested.
Have you been tested?
I have. I've been tested 1 time. Okay. That's more due to my schedule, less to kind of my limit of exposure. But yes.
Okay. And how many people have been tested overall, do you know, at Alliant?
Yeah. So overall, we've had over 22,000 people get tested from our entire time of operation. Yesterday, we set a brand new record for our daily total, as that was over 2,000 people who came through just yesterday.
Wow.
Mm-hmm.
And how many people of color have been tested?
That's a great question. And I think I might have the most recent number. Let's see. Actually, I don't. I only have the percentage. So as of last week, we had about a 10% rate of African Americans who were getting tested through the site.
What about Latino community?
That's a good question. The Latino community. Let's see.
Because our audience is broad, so we have our Native Americans, we have our Southeast Asians. I mean, we have a broad audience.
Yeah. Let's see. I was trying to reference our dashboard, as I know we were having it up there.
But 10% is higher than the population of Madison, so I mean that's...
Yeah, so we're doing great. And it does fluctuate based on kind of how many people we have come through. I can send you all of the race breakdown data because I want to make sure you get them.
Yeah, I was just curious for our viewers that they get a perception of, for people to understand, how many of these people are going, especially because it's impacting the Black and brown community higher than the other populations. Just want to know how they're getting tested and
Yep.
what they're doing. What are you guys doing to make sure that you're getting the word out and reach people of color and helping them making sure that they are getting tested? I think it's really important, especially in the summertime, right? Like I could. This is probably the best time to get people to come out. Probably the worst time at the same time, because who wants to go sit in line and get tested and then want to So, what's the strategy making sure people of color are getting the word about this stuff?
Yeah, so I think it's a twofold approach right now. So one, we want to make sure that our communities of color have adequate information to support the messaging around testing and that it is safe. That gives a little more insight into our processes, because I know people have a big fear, and especially around kind of government processes. And so we want to make sure that people know that we have taken the cultural competent approach. We are collecting the only information necessary, nothing more. And also being able to have availability for our communities of color to ask questions, because I think that's how we really drive forth doing a lot of myth busting. I know we've had to do a lot of that around like, oh, what does the test look like? Is this the one that goes all the way back into my brain? Just being able to answer some of those questions, I think is crucial from a messaging standpoint. And then the other thing that we are doing is setting up community pop-up testing that are really going to have some neighborhood and geographic and also cultural competency kind of all rolled into one as to where we set up these community pop-up testing sites. So we've been working with some of our bigger community of color organizations to identify locations and geographic regions where we need to have those community pop-up sites. And so we're trying to make those a little less formal than the Alliant Energy Center site, so that we're working with these communities these community organizations that are embedded in these neighborhoods, right? So this is your neighbor who's helping us put on the testing, right? This is your person that down the street. To really kind of give it that more centralized and community feel for testing, and also make it more accessible. We recognize that Alliant Energy Center, it is on a bus line, but let's be clear, the bus stop is a hike and a half from where the center is, and we want to make sure that we are removing as many barriers as possible for people to get tested.
Yeah, that Alliance far out too, so it's definitely out there. But that's good to hear you guys are being intentional about what you're doing. So I love that. So off that stuff and the COVID-19 stuff, as a Black woman, how are you appreciating Madison? What's your experience right now in Madison? What do you think?
Yeah, so I love it. It's funny, I'll be honest, when I told my family I was moving to Wisconsin, everyone thought I was having a breakdown. They were like, what do you mean you're moving to a dairy farm? And I was like, whoa. Anyone who's ever met me knows I am not cut out for agricultural life. I said, it's a city. It's a city. Don't worry, everybody. And actually, it's funny because my family's come out a couple of times to visit, and they actually love it too, which is funny. Now my parents are like, maybe we'll retire here. I'm like, I think we need to talk about that. But I do. I love the culture of Madison. I love especially how we as a Black community come together and really push forward issues that need to be raised. And I think we're seeing more of that, especially now and in the past couple of weeks. And it just feels really supportive. I love the more laid back environment. I love that there's a lot to do and a lot to see, and still close to the major cities of Milwaukee and Chicago. So
yeah. Do you get to Chicago, Milwaukee often?
You know what? I was getting to Chicago a little more often. I have on my to-do list, or my bucket list, my Madison bucket list, as I like to call it, to make more intentional trips to Milwaukee, and then COVID happened. But I hear that there are some great restaurants for me to check out in Milwaukee. So, yeah.
Milwaukee's actually a pretty cool city. I think, it gets a bad reputation for the violence. There is some violence there, and the segregation's true. But it's actually a really cool city. I mean, there's so much to do in Milwaukee. There's so much to do in Milwaukee. You should check it out.
Yeah.
You should check it out.
Well, and from a professional standpoint, my kind of discipline in public health up until this point has really been in violence and injury prevention. And so I've known Milwaukee as kind of more from the public health research aspect. And as they've talked about how that segregation is really driving a lot of the violence that is seen in Milwaukee, it's somewhere that I want to kind of be more boots on the ground with, and kind of look into and see like, yeah, what does this look like with this kind of very blatant, especially geographical segregation, and how that has played into some of the other violence and injury prevention factors in Milwaukee. So I'm really looking forward to it post-COVID.
Yeah, it's a great city. Okay, so before we go, where can people find out more information about the COVID-19 or the testing? Where can they go to find out more information?
Yeah, so for more information, please visit our website. It's www.publichealthmdc, as in Madison, Dane County.com. You can also just Google Public Health Madison, and I think we're the first result to come up. So that's where you can get more information. I will also say myself and my team, we are at Alliant all the time, anytime it's operating. And so truly, if you have any questions, just ask one of the many people you'll greet here and just say, hey, I have a question. I need to talk to somebody from public health. And they'll come get us, and we're more than happy to answer any questions, comments, concerns you have.
Are you the first Black woman in that position over there?
I believe so.
I bet you are.
I believe so.
I mean, there's not too much people I don't know in this county who've been like, I think you're the first Black woman there.
I believe so, and it is my personal mission to not be the last.
Oh, amen. Okay, Philly. I see you, Philly. All right, that's that Philly in you, that fire, that Philly. Hey, so sincerely, thank you for all that you're doing. And, first being the first Black woman there, kudos to you. First, I would say first in the door, first to get shot. But, yeah. And I've been in that position my whole career, so
yes.
I get it. But thank you for all you're doing. Thank you for keeping a standard for our people, and make sure that you're being intentional about reaching our community. So thank you for all that you're doing. I'll be blessed. Stay healthy. Yourself, stay healthy, because if you're around a lot of folks, you're susceptible too. So thank you for all that you're doing. You're always welcome to come back to our show and talk more about how the Packers are the best and Philly is whack. And all that stuff. You will come back and talk about how cheese curds are the best and Philly steaks are nothing compared to brats. All that stuff. Come back and talk, and we can talk all that good stuff at some point to set you right on this real Wisconsin way. But I don't want to do that to you right now. I don't want to do that
Thank
to you.
Thank you.
I don't want to do it now. So thank you for joining us, and we'll see you next time on Real Talk.